Good afternoon. Our names are Kelsey Brown and Brittany Hinkle, and we are December graduates in the Grandview University Nursing Program. This is our senior presentation for our policy project on organ donation.
Over 100,000 Americans currently wait for a life-saving organ transplant. Over 550 of those people are local Iowans.
Of those 100,000 Americans, 17 people die every day waiting for a needed organ transplant.
This means that nearly 6,000 people die every year, or one person every 85 minutes because there are not enough donated organs.
Every day, 102 names are added to the National Organ Waiting List. That is one person added every 14 minutes every day.
Up to 100 people in need of organs and tissues can benefit from one person's decision to be an organ and tissue donor.
With recent advances in medical technology, more people than ever before can be donors. The trigger point for our chosen research topic came from the simple fact that the supply of donated organs does not meet the current demand. We focused our energies on trying to identify why organ donation procurement rates are not increasingly becoming better, and found a wealth of information regarding organ donation and the knowledge deficit that our society faces with such topic. We were able to identify that there is a growing interest in the concerns of organ donation and that there are numerous efforts across the nation being spearheaded by public and private groups, as well as the legislature, to increase the availability of organs and tissues for available donation. So why does the supply not meet the demand?
Through our colleague sheep analysis, we were able to identify stakeholders and research that would point us in the direction to find the answers. We found an extensive body of information documenting the need for organs and why donation rates appear to be less than optimum. We identified correlations between an individual donor and their family in which the patient wished to donate organs, but after death the family refused to allow donation. The patient was not clearly identified as a donor, or the family was not asked about organ donation when end-of-life tragedy occurs.
We were also able to correlate between the fact that healthcare professionals are responsible to identify and approach families of those who may be possible donors. A lack of initiative on part of the healthcare workers, misconceptions about death and transplantation, lack of effective communication between healthcare professionals and families, as well as an overall knowledge deficit on organ and tissue donation are all contributing to the low procurement rates.
Our next goal was to identify research through our literature review that would support these correlations. We studied research that was aimed at identifying knowledge deficits as well as the attitudes of healthcare professionals, especially nurses, donors and recipients, their families, and current healthcare situations in the fields of nursing, medical, and health technician specialty areas.
After gaining knowledge on all of these aforementioned topics, we decided to take an interest and pursue more research studies that were aimed at identifying the barriers and knowledge deficits in current professional nursing practice, in conjunction with current nursing students and the curriculums in which they are currently enrolled.
Registered professional nurses are often the primary caregivers for patients approaching the final stage of life. It is the nurse who facilitates the coping of the patients and their families. Recent studies continue to document knowledge deficits in nurses about organ donation and retrieval. Although many educational programs include an organ donation component, our literature research revealed that a significant proportion of schools failed to provide instruction on the donation consent processes, definition of brain and cardiac death, and the discussion of organ donation during a routine health care visit. These skills may be important for students to be exposed to before entry into the workforce, as many current healthcare professionals still indicate difficulties with understanding and explaining brain death and the procurement process to families of individuals that are facing end-of-life scenarios.
We found that most schools rely on lectures as a sole method of organ and tissue donation instruction, and found the need for further recommendations for how deficits in instruction might be addressed through intervention and education in school curriculums. In addition, we discovered that most nursing curricula do not have formal instruction on this complex and emotional-laden process, and there are no required postgraduate courses on organ donation and transplantation. Although some studies have examined graduate nurses' attitudes and knowledge of organ donation and transplantation, the effect of present nursing curriculum to prepare nurses for an important role in organ donation has not been examined. Through this research, we began to understand that the undergraduate program would be an appropriate place to introduce nursing students to this sensitive topic.
Given that increasing organ donation is an important healthcare initiative and that nurses play a key role in the organ donation and transplant process, our nursing schools should be evaluated on how well they prepare our future nurses for this activity. If improvements are needed in the curriculum, an efficient and effective way of introducing these initiatives into the already packed educational program should also be evaluated. We therefore have decided to utilize the Nursing Research Stettler Model. The Stettler Model design is a structure for using the research conducted and creates a vehicle for changing policies and procedures. Individual nurses, such as practitioners, educators, and policymakers, summarize research and use the knowledge to influence educational programs, make practice decisions, and impact political decision-making.
In order to better the procurement rates, adequate training in these sensitive topics would be a prerequisite for a behavioral change. Thus, the importance of implementing changes into nursing school curriculums may create a key group of healthcare professionals who are better primed to learn and implement appropriate donation practices at their future places of employment.
To guide the learning and decision-making of students, faculty members in the nursing programs must find ways to engage and educate students with regard to organ and tissue donation. For example, with the presently identified deficits in donation education, nursing programs might turn to colleagues that work at organ procurement operations, such as the Iowa Donor Network, to provide instruction on topics that may be unfamiliar to instructors themselves. The OPO staff may offer valuable insight into the constantly changing policies that are embedded in the donation transplantation area of studies. Implementing nursing theorists such as Cornelia Ruland, who has developed the peaceful end-of-life theory, would be beneficial in equipping nursing students to tactfully approach the end-of-life caring process and facilitate effective communication regarding organ and tissue donation between healthcare professionals and families. In addition to this, implementing Madeline Leininger's theory of transcultural nursing would allow nurses to discover how families feel about end-of-life issues, such as donation, and identifying how the individual beliefs and values of the donor and their families may help to customize a care plan for the individual and their family at end-of-life scenarios.
Our policy document is specific to the Grandview University Nursing Department. Reflecting back on our experiences through the nursing program, both of us felt that we were not provided with enough information or knowledge to be prepared to encounter the topic of organ donation in professional practice. We therefore have recognized the need for the university to reevaluate their curriculum concerning end-of-life care and organ donation. Together, we have created a policy that is to be implemented into the Caring Responses course. This curriculum is to include the definition of organ donation, tissue donation, cardiac death, and brain death. In addition, students are to reflect back on their communication skills and practice how to sensitively approach a topic such as organ donation and brain death, and learn how to effectively communicate about these two topics with their peers. Information such as organ procurement operations will be included into the curriculum, as well as how to register to donate organs. The nursing department and faculty will be able to evaluate the effectiveness of this implementation into the 302 curriculum by lecturing and testing over end-of-life issues. If students are able to explain the different types of organ donation, as well as the difference between brain death and cardiac death through short answer testing, reflection through journaling, or dialogue in class, then this action plan will be deemed effective.
The journey through Professionalism 2 has been a long process. In the beginning, we both just had an interest. Our interest piqued a concern in both of us, which ultimately helped us arrive to where we're at today. We've learned that making change is hard and that finding reasons for why things haven't changed is even more difficult.
We've discovered that there are barriers all around us as novice nurses, but that with a little hard work and investigation, the barriers aren't quite so invisible anymore and are merely a roadblock that over time you will be able to clear the path for.
Overall, we've learned that the nursing field changes constantly and that change must be recognized by those who are currently practicing or by those who are studying the profession. We must be the small part that makes a big change.
We would like to thank you for your time this afternoon. We welcome questions openly.